The DAPA-HF trial was just recently presented to European Society of Cardiology, actually just about a week and a half ago, or 2 weeks ago, and the questions that was asked in the DAPA-HF trial, which was really important landmark study, was to try to understand whether SGLT2 inhibitors, and specifically dapagliflozin, can be an effective treatment for patients with heart failure and reduced ejection fraction. Now, what we already knew from the cardiovascular outcome trials of SGLT2 inhibitors and kidney outcome trials across different agents in the class is that they're very effective agents in preventing heart failure in high-risk patients with type 2 diabetes. But what we didn't know is whether those agents that are effective in preventing heart failure can also be effective in treating patients that already have established heart failure, specifically with reduced ejection fraction, and whether they are going to be effective in treating heart failure regardless of presence or absence of type 2 diabetes. Remember, these were initially developed as type 2 diabetes medicines that lower blood glucose. The heart failure effects emerged in cardiovascular outcomes trials, but what wasn't clear is, will they be effective treatments for heart failure, and will they be effective as treatments for heart failure regardless of diabetes? And so what we saw in the DAPA-HF trial is that the answer to both of those questions was a resounding yes. The compound dapagliflozin was highly effective in reducing death from cardiovascular disease or hospitalizations for heart failure in that patient population, of whom more than half did not have type 2 diabetes. And on top of that, it actually was highly effective in improving those outcomes regardless of type 2 diabetes status. It made no difference for the patients that didn't have diabetes. The effect estimate, the treatment effect, was essentially identical. The DAPA-HF trial is a study that we did in 26 centers in the United States in a very similar patient population. So these are patients both with or without diabetes that have reduced ejection fraction heart failure. And what we were looking at is the effects of the compound versus placebo on health status of patients with heart failure. What health status is symptom burden, functional status, and the quality of life in patients with heart failure. So remember that there are several key goals in managing heart failure. One is to reduce death and hospitalization rates, but a second and equally important goal of management is actually to improve the health status, to make patients feel better. So to reduce symptom burden, improve functional status, and the quality of life. And that's exactly what we're looking at in the DAPA-HF trial. That's a study where patients were randomized to dapagliflozin 10 milligrams daily or placebo and followed for about 12 weeks. And what we observed, essentially, the main finding is that dapagliflozin was more effective than placebo in improving health status of patients with heart failure. So a greater number of patients treated with dapagliflozin versus placebo had clinically meaningful and substantial statistically significant improvements in their health status as measured by Kansas City Cardiomyopathy Questionnaire, which is a gold kind of a gold standard of how you measure health status in heart failure.